I am from Myanmar. When I was born, this little girl, at the time the doctor said she got a small hole on her head, and but at the time she is so small, and then doctor say wait for up to 5 years. They say the small hole also automatically closed because of baby growth, but later after 3 or 4 years also she still have a hole. And then after that we know that one doctor coming from Yashoda Hospital, he is a cardiologist. This one is a best chance for my little girl, because we are planning to see this doctor Raghu. And then we went to the hospital and saw this doctor, and then he say we have to wait for a while or 1 or 2 months, and then he next time we went there and saw this doctor, and then he told us his plan. They have a surgery because her hole is very close to her birth. This one they cannot close by device. She need to do an surgery. So we plan everything with Dr. Raghu. We check with them how much and then everything. So he told me about the detail of everything, and then he planned for us everything, and we came here and do the surgery. And now she is feeling very better, and she is a normal, and she can do everything. She can play, and she eat very well. No?
Bowl of rice.
Yeah, you can tell.
You can tell.
I eat a bowl of rice.
A big bowl. No?
Phue, my friend, met me in Yangon. This little tot is very energetic. She had a ventricular septal defect and aortic regurgitation. Normally, small VSDs we can close without surgery. So they had a hope that we could close without surgery. But she had an aortic wall leaking. So we had to suggest them a surgical closure. In Myanmar, surgical closure can be done, but what happens is, because this is a complex type of a ventricular septal defect, they prefer to come to Yashoda Hospitals, Secunderabad. So we performed the surgery of closure of the ventricular septal defect, and the aortic valve did not require any surgical replacement. So with one surgery, we achieved 2 objectives of closure of the VSD and repair of the aortic regurgitation. So following surgery, she had a very fast recovery. She continued to be energetic. She recovered very fast. She got discharged on day 5. Now possibly tomorrow they are going back home. And Phue, how did you feel? Was the surgery painful for you?
Yes, a little bit pain.
A little bit pain. But you were playing, and then you were teasing everyone in the hospital. Yes, you were teasing, no?
No, Dr. Phue not tease me.
The doctor teased you.
Yes.
Oh.
So I'm so angry.
You are so angry with the doctor.
Yes.
But your mother seems to be happy with the doctor.
Ah!
So do you think the surgery is tough or easy for you?
Little bit tough.
Little bit tough. But do you have any pain now?
No.
No? So no pain. So how long, when was your surgery done? A week ago? 10 days ago? 10 days.
10 days ago.
10 days ago. Okay. So okay, after going back to Yangon, you can play in your school, be normal. Okay? You don't need to see the doctor again. Okay?
Okay.
Have a nice trip to the mall again along with your parents, and then ask your father to buy you something. So, okay, and good luck to you, and I am sure you will become a very bright, promising girl and contribute to your country.
Thank you, doctor.
Thank you. All the best to you, Phue.